Now I'd like to introduce Ruth Lunn. She directs the Office of Report on Carcinogens, which produces the report on carcinogens for the NTP. And she's, within the NTP, she has the longest history in working on this topic. And so she's really been moving it along over the last few years. Recently joined by Wendy Boyd in the Office of Health Assessment and Translation to sort of work on the non-cancer side. So again, you can really sort of, it's Ruth and Wendy and the team that they've been working together that have really put this together. So.
So I just want to give you some background and go over the objectives of the workshop on shift work at night.
Really hard to hear you.
Okay, is this better?
Yes.
Okay, sorry about that. Chris just introduced myself and Min. What I'd like to do today is just tell you who NTP is and ORC and OAT, tell you why we're interested in this topic and just briefly define it, and then do the objectives, how the workshop's going to work, and then what's going to happen after this workshop. So the National Toxicology Program is an interagency program, and it evaluates and does research and also has analysis activities on things that are potentially hazardous in the environment, and it communicates this information to federal agencies, to the scientific and medical communities, and also to the general public. And so OR and OHAT are part of the analysis programs. We also do in vivo animal studies looking at cancer and other endpoints, and also we do predictive toxicology such as the Tox21. And then the other evaluation analysis that goes on is we have NIEHS that evaluates alternative toxicological methods for reducing the use of animals. So let me just tell you a little bit more about OHAT and ROC. And OHAT does systematic reviews on health effects and mainly looks at non-cancer endpoints. And basically it carries out two different kinds of activities. One is hazard identification, and the other is reaching non-quantitative level of concerns. And this is when they sort of integrate the hazard information with exposure information, and they reach concerns that's not a quantitative risk assessment, but to give you an example, it would be when they reach concerns in the past for DHP, they would reach a different level of concern for neonates that have high exposure versus adults which might have lower exposure. And then Chris said that we prepare the report on carcinogens. It's a congressionally mandated document, and it lists substances that are either known or reasonably anticipated to be a human carcinogen, and to which a significant number of people residing in the United States are exposed. And this is just a hazard identification, and it's not meant to be a risk assessment. So why are we interested? Well, our interest was initiated by nominations by several people in the public, and they nominated Light at Night. And then for both looking at cancer and non-cancer outcomes. And the basis for the nomination for the cancer outcomes was the IARC review that shift work that involves circadian disruption is probably carcinogenic to humans. However, their comments were more about just workers. They were really also concerned about the general public being exposed to artificial light at night. And so because of that, we kind of defined this huge topic called shift work at night, light at night, and circadian disruption. And we prepared what we call a concept document, and that's basically our rationale and our approach to say that we want to review something. And we presented that to our Board of Scientific Counselors, and then it was selected as a topic for review. So we call it a candidate substance for potential listing in the report on carcinogens. And so one of the first steps that we did was we realized that we needed to do was to reach out and get external scientific input on characterizing these exposures. And I think Dr. Stevens was part of that board meeting, so we want to acknowledge his help with that. And so now we're working together with OHAT to get scientific input, and that's what this workshop is about. So first I'd like to sort of talk about, just briefly define the topics. These are going to be defined much better by our experts, but just to point out that electrical light is the hallmark of the Industrial Revolution, and it paved the way for people to eat, work, and conduct activities through the 24-hour cycle. And so this is an exposure to everybody, not just workers, and people are exposed via outdoor light pollution or inside while they're sleeping. We know consumer electronics is on the rise, so it's widespread exposure. And then in addition, we have economic globalization and the demand for goods and services 24/7. We live in a 24/7 society. And so some of the occupations that have a high numbers of night shift work are first responders, people in the healthcare practitioners. We want to be entertained all the time. We want to be transported all the time. And, to keep up with demands, there's manufacturers and mining. In addition to that, we know that there's concerns for adverse health effects. Electrical light can vary in intensity. It can be all time and can be rich in short wavelengths. Studies have shown that it suppresses production and release of melatonin and disrupts the circadian rhythms. And this occurs, circadian disruption occurs when the endogenous circadian rhythms are out of phase with each other and with the external environment. We know light is the key determinant of the central clock, but there's other exposures that are more important in our peripheral clocks, and I think we're going to learn more about this later. And then in terms of shift work, we know that they're exposed to light at night, but it's more than that. It's, there's differences in meal timing, and so we felt like we couldn't just define this as shift work or couldn't just define this at light at night, and we know circadian disruption. So that's why we have this big topic, but yet we know that how are we going to evaluate this complex topic? So we needed to reach out and get this scientific input on these topics. Then that's the main goal of this workshop. We're not asking people to come to conclusions about whether this should be listed, or we're not there yet. We're just starting our evaluation. And this is a workshop in that we're having individual comments and group comments, but we're not trying to come up with a consensus statement. So I just wanted to sort of just give this slide about how there's a huge database, and we need on these topics, and we need to come up with some ideas of how to synthesize across these different exposures and different types of evidence streams. And so we have human epidemiological studies that are looking at shift workers or looking at light or sleep disruption, and most of them are just really looking at endpoints, and they're not necessarily characterizing light and all the factors that might be important. Although there's some studies that might look at shift workers and the biomarkers, but they're not always putting everything together. But we can be informed. We have mechanistic and animal studies that might be able to inform that literature. And there are, on hormones and clock genes and epigenetic changes. And so this is what we want to try and come up, what literature is important and how do we interpret it. And so to do this, this meeting, to get our goals, we knew it was a stepwise approach. So we just wanted to point out some of the steps that occurred previously. And the first step, at least for OAT, was to try and identify what health outcomes they're going to study. And so they're strongly targeting cardiovascular, metabolic, reproductive, GI, immunological, and neurological outcomes. And then we wanted to have a little idea what the scope of the work is, and so we prepared these abstracts and some appendix tables, and that's available on our website, and it's not meant to be a review of it, it's just to get the scope. And then, of course, we're going to have presentations that are going to do a much better job of pointing that out today. And then, as I mentioned before, these are our objectives. That's what the workshop discussion is going to be. And we also, some of the other issues that we want to come out of this workshop is some ideas to identify data gaps and research needs, and that's the last session. What's the plan of being able to accomplish this? Well, we divided this workshop into 6 sessions. So today we're going to concentrate on, we need to know what circadian disruption is, that's key, so we're going to concentrate on that today. And then we're going to, tomorrow morning and at the beginning of tomorrow afternoon, look at the environmental disruptors of circadian disruption, ALAN, night shift work, sleep, and other exposures. And then in the afternoon, we'll get to the overall goal and identifying the research needs. And then just to lay out what the format's going to be. So basically, we have a moderator for each of these sessions, and they're going to go over what the goal is. And then we'll have the presentations by our experts. And then it's a moderator-led discussion. So they're focused questions. They're going to be asked to key people for each of the sessions. And then we can open those questions up to the entire panel. And then we have the rapporteurs and the moderators will hopefully capture what these key discussion points are, and they can inform the next session. Okay, so, and then finally, what are we going to do afterwards? Well, we're recording this webinar, and we'll be able to put that on our website. We hope to prepare a report. OAT hopes to take a concept to the board in the December meeting, which will lay out what the research question is and their overall approach of doing that. And then we'll use this input that we get to help develop what we call a protocol, which is basically our methods for doing our evaluations. Which studies are we going to include? What are the important models? How are, the things that we learned today? And then hopefully we'll have identified research activities. And then the panel has introduced themselves. We're very fortunate to have all these experts, so I won't go over their names again. I do want to point out that a lot of people have participated in making this workshop. Chris was also one of the organizers of the workshop, besides Wendy and me. We know that we have the moderators, and I think those people have been introduced. And then the people doing the technical support help pull together these appendix tables and background materials. So I just want to know, does anybody have any questions? Okay, thank you.